qualified as a theatre nurse in 2012 and I've worked in theatres ever since. So my very first job was in paediatric theatres. As a student, I just had a strong desire to work in theatres after having a placement.
I worked in NHS acute medical assessment, so totally different environment. I worked there for quite a while, for quite a few years, and I just wanted a complete change.
I'm French, so I came in London about 12 years ago, and I've done my nursing diploma. So since then, I've been nursing. So I've started in general acute, and now I'm in ophthalmology, which I like.
So I was at High Street Opticians before. I did some qualifications with them there, and I also was in-store trainer. I've been there for 8 years, fancied a change, enjoyed the patient care side, and then I found SpaMedica, and then I came here.
I was a nurse for 3 years, and then I saw SpaMedica's post on NHS Jobs and decided to join. I wanted a bit of a change. I saw the flexibility there, and sort of no night shifts, no weekends, although we just do 1 in 4, which is great. It works well for my life.
I didn't have any life before. Now I have a chance to see my friend, go on a weekend, and just live life basically.
Basically, I wanted regular hours because I've been doing a lot of night shifts, a lot of weekends. I needed to increase my hours to work full time because I was a part-time nurse because I'm a mum, and I didn't want to work more night shifts. So I was after a regular, more sort of daytime work pattern. I just saw the job advertised as day surgery. I didn't understand what SpaMedica was, so I applied for the job.
Okay, ophthalmology is not a scary field, so if you are willing to learn, that's the main thing. Most of the staff that are here, they were not ophthalmic trained, so it's okay to come and have some more experience in a different field, and you will enjoy it. Yeah.
I think that it's a good opportunity if you're ready to cross onto or into another area of work. Ophthalmics it's exciting as well. No any one day is the same.
We're rotated. One day we're assessing, pre-assessment. The next day I'm in discharge today, for instance. I might be in the admit room. So for our 4 days a week, we can actually be rotated, and there is a chance you can work as a scrub nurse as well. So not every day is the same. There are those 4 parts of the job. So, there's a lot to learn.
From a nursing point of view, over here, so I am employed as a scrub nurse. However, I've been involved in the clinical side of things. So I do pre-assessment clinics, I do patient admissions before theatre, I also do discharge, I scrub in theatre as well most of the time. But I think for nurses it's great that you get to do a rotation of things. Here you're in sort of clinic, like I said, then you also do a bit of post-op care for patients when we're dispensing medications. It's nice to see that side of things too. So for example, seeing a patient in pre-assessment, I sort of reassure them that I'll probably see them in theatre, and I've had that many times, and it's very nice because you have that rapport with the patient already.
I love that when they come in, it's a continuous journey, so you see them from start to finish. You'll see them when they come in for their consultation, to when they have their procedure till the very end. All their friends and family are always really happy when they come in. You can sort of take your time with the patient, make them feel comfortable, make sure you feel confident in what you're telling them, and then you see them all the way through their journey.
Everyone is professional, we help each other when there's an issue, everybody is ready to help out. It's a very good team.
But our team members are really, they all work together, and there's such opportunity. I've never worked on the clinical side, I've worked only in theatre, so you've got opportunity. If you're an opportunist, you know, you can work on the clinical side, you can learn biometry, you know, as well. So you've got a lot of opportunity, you know. Here you're lucky enough to be able to rotate around all of and be trained with really, really excellent trainers in everything.
I had a trainer for each competency, and you get signed off on your competency. You work with them and then they step back. I would say the training is fantastic. I felt well supported because I've come from a different speciality. Although I'm a very experienced nurse, I didn't know anything about eye surgery, so I felt I was well supported as I learnt my role.
The trainers have been unbelievable. They've been there from day one till now. We're still having training. They teach a lot in a small amount of time, and it's really well planned. You always know what you're doing when you come in, and they've been really helpful, always at the end of an email if you need help with anything.
In terms of progression, nurses here, you can go on to being a clinical lead, there's a theatre team leader post as well.
Part of my interview, we discussed a bit of it, so there's plan that we actually discussed, and some of them are starting to be fulfilled. So yes, I'm happy with that. There's a lot of opportunities with that company.
Everyone's friendly because we're a small team. We're all very supportive. It's a lovely team environment, and we're all learning at the same time. So it's quite a unique experience, and I'm very glad that I joined SpaMedica when I did.
From where I started to where I'm at now, I think my time here with SpaMedica has been great. It feels very sort of stress-free.
I think the work ethic here between the team members is really strong, especially in theatre. I think if you've not worked in theatre before, it can be quite a daunting area because, you know, everything is done aseptically. It has to be to benefit, you know, the patient.
It's a wonderful place to work. It's very different to where I was previously. You have that work-life balance like I mentioned earlier. And it's been wonderful so far. So I'm looking forward to the future here.
It can be challenging at times, but working here makes that challenge, or those challenges, worthwhile. So I'd say, you know, come and have a look round and see what you think.
Definitely do it. Make that change. You'll be supported all throughout your journey. The staff we've got here are amazing, as when we've travelled to other hospitals they have been there as well. They're really welcoming, they're really helpful. Make that jump, do it.
Well, the staff, I think, were excellent.
Oh yeah, they're absolutely brilliant. No sad faces, all smiley faces, and they really do look after you.
Everybody has been outstandingly pleasant, I must say, and reassuring.
Everything's organised, people are very efficient, very friendly.
The surroundings are nice, the staff are friendly, they explain everything, very informative, very professional.
Everybody is so reassuring.
I couldn't fault them. They were all been very nice, brilliant.
They're so thorough and professional, it really was amazing.
They're very good.
It's absolutely super.
I'm very, very pleased indeed.
Oh, they were brilliant. They really looked after you.
It's pretty good.
It's fabulous.
It's amazing.
It's absolutely brilliant.
Very professional.
Brilliant. Absolutely brilliant.
Absolutely fabulous.
Fantastic. Absolutely fantastic.
It was 10 out of 10.
I'd definitely give them 10 out of 10. And it's been super. No problems at all.
You get the absolute best of attention. I just can't fault the place.
I couldn't ask for better service from anybody.
I can't praise them enough, to be perfectly honest with you.
I was very impressed indeed.
And I'd recommend this place to everybody, because from start to finish, you really do get looked after professionally.
I chose SpaMedica.
Got to recommend it very highly indeed, yeah.
I'd recommend it to anybody.
It's a wonderful place, this, it really is.
If you're worried about coming in because of COVID, then rest assured, every precaution is taken here, masks, temperature, all the safe distances, so I wouldn't hesitate.
Absolutely fantastic. From coming at the door, everybody, was greeted, temperature taken, procedures explained, and staff have been, fully got all the equipment on, so yeah, it's been fine.
The treatment you get in here, well, it's like private, isn't it? It's a bit more personal here, I think, isn't it? Everybody's reassuring you. They're all really nice, yeah, I think it's lovely.
Very, very helpful, very obliging. They can't do enough for you, seriously. And put you at ease. Yeah, anything you want to ask them, they will answer you.
The treatment is just the same, and an excellent service.
They're really wonderful. They are.
They're absolutely, I can't thank them enough. SpaMedica, they're brilliant.